Awesome. Super excited to have you join us, Karen, on Non-Fungible Human. I have really kind of seen the exciting things that you've been doing at Verizon and wanted to learn a bit more about those things. So you're the global lead of connected health strategy and innovation at Verizon Business. And so I imagine that encompasses a lot of things. Could you start by kind of giving me a summary of what you may do and what falls under your portfolio?
Yeah, absolutely. Thanks for having me. Excited to be here and share what we're doing and our role in the healthcare ecosystem. Yeah, it's a long title. So Global Lead, Connected Health Strategy and Innovation. And essentially what that means is in our charter and mission is to really look at all the assets, capabilities across our entire Verizon portfolio, which is pretty vast. I know we'll get into that in a little bit more detail. Um, Through our conversation. But if you think about our tech stack, I mean, it's the network and all the different types of connectivity solutions from fiber to 5G connectivity to, um, uh, uh, the core network assets. And then we build on top of that what we call above the network solutions around security, CX or contact center, call center solutions. Um, Network as a service solution. So we bring those forward on top of the network, integrate it together. Then we add in the applications, business solutions on top of that. And our focus is really, so those are horizontal solutions, but our team takes those and we think about and co-create use cases to help solve problems in healthcare. So and we're outcome focused. So our sole mission is how can we improve outcomes in the healthcare industry around cost of care rising, right? So we look at optimization and infrastructure solutions from a kind of a technology standpoint, but then how do we align with value-based care models and managing chronic preventative care, chronic disease management. That's a big area of focus. A lot of challenges with the workforce, shortages with labor. That's getting, I think, worse instead of better. It's going in the opposite direction. And even the burden and the burnout we're seeing with clinicians and staff. So how can our solutions help alleviate some of that burden or automate workflow, right, to do more with less? We get involved quite a bit in equity and access solutions, patient access solutions. So that's a kind of near and dear to my heart, a personal passion of mine is how do we extend care to underserved communities? And then also just looking at care redesign, care transformation. So, and how do we align with that? And last but not least, we also look at, how do we weave security into everything that we do to secure the network platforms and the ecosystem for our customers. So we're on the business side, and which means so we're in our world, we're talking to the health systems, the health plans, the med tech companies, retail health providers, which has been an interesting area, disruption. So that's our charter.
Yeah,
Yeah.
that's a lot.
Yeah.
A,
Yeah.
a
That's a
lot of
lot. Yeah.
different things.
Wear a lot of hats. Yeah. We're part strategy, part innovation, part business development. I mean, our ultimate goal is to, again, improve outcomes, but also monetize that, for Verizon, we're a for-profit company. So we want to do good and make money as well.
Yeah, absolutely. And
Yeah.
obviously, a lot of the things you mentioned are massive problems in healthcare, and there's no shortage of problems. And it seems like you all have a lot of solutions, which we'll get into here in a bit. Just a bit more about you. Your background's in computer science. When did you kind of get into the healthcare world? Was it at Verizon or even before that? Or tell me a little bit more about your
Yeah,
background.
it was before, and I appreciate you bringing that up. And no one's even ever noticed or brought that up in a while. I started in computer science. Didn't realize actually at the time I was kind of an early pioneer for women in STEM, and it's kind of a funny story how I ended up majoring in computer science, but two reasons. One, my parents said to get a job my junior year of college, and I hadn't declared a major yet. And a friend of mine who was 2 years ahead of me was graduating. She had a job on campus and said, oh, she needed to find someone to take her place. So I was like, oh, I need a job. And she
Yeah.
said, there's only one caveat. You've got to major in computer science. So I was like, done. And then, so that's how I got into it. And so I did start my career in software development. did a number of different things on the technical side with network design, network delivery, network consulting, and then crossed over onto the business side about 10 years in. And I worked in every vertical industry. I was, consultative, strategy and sales for a lot of Fortune 50, Fortune 100 companies across transportation, hospitality, financial services, manufacturing, retail. So, which has actually been interesting to bring some of those innovations into healthcare. And about 12 to 15 years ago, I am active in the Atlanta business community where I'm based, and I was president of a nonprofit volunteer professional networking organization called the Association for Telecommunications Professionals. And our charter was, how do we raise and elevate what the greater good of what technology can do for industries? And through kind of a haphazard way, we came upon a little nonprofit called at the time the Georgia Partnership for Telehealth, which is now the Global Partnership for Telehealth. And they were building like standing up telemedicine networks all through Georgia, and then also globally in Africa, Guatemala, et cetera. So I met them, we showcased what they were doing, and I thought to myself, oh, I want to find more purposeful meaning in what I'm doing. And I was really intrigued by what they were doing and pivoted. And I really kind of saw how telecommunications is really kind of the core asset that can help bring a lot of these solutions to life. And so I left the corporate world for a while, went to do some work with them. Through them, met some other companies that I started working with as well in the startup world. This was all pre-pandemic, and really immersed myself in the healthcare space. I also come from a medical family. My father's a retired physician, my mother's clinical psychologist, and so kind of grew up in that and wanted to, I guess, do my part, if you will, even though I'm not clinical. But so I pivoted my skills, and then Verizon came knocking and recruited me. But the initial role, I've been here 8 years. My initial role was not in healthcare, actually, but about 4 years ago, we stood up these vertical domains teams, healthcare being one of them. And so I was uniquely positioned to join this team. I can speak kind of what Verizon does and that infrastructure language, and I'd also had immersed myself in the healthcare industry. So kind of a long-winded answer, but that's how I ended up, and I really haven't looked back. And again, it feels more meaningful and purposeful, at least to me, solving problems and trying to have an impact.
No, yeah, that's amazing. A normal person, average person looks and they think of the medical system as, maybe doctors and hospitals, but there's so much more to it. And that includes obviously yourself and Verizon. And we couldn't do anything that we do without technology solutions that are reliable 24/7. And, for example, here in Houston, we had no internet a while back because of storms and whatnot, and the hospital is just dysfunctional. And so at times like those, you realize how important all of this infrastructure is to save lives essentially. Um, so kind of shifting gears a little, I think the thing that like myself, a practicing clinician and others, when they think of, large organizations like Verizon and being involved in healthcare, it seems vague. We're not really sure what you all do, how it helps us. And then that's kind of my job with this podcast to kind of delve deeper into those things. And so kind of
Sure.
looking through y'all's website, it seems like in the healthcare domain, there's kind of four large umbrellas, if you will: digital intelligence, patient experience, security, and remote care. And so if you're okay with it, let's go one by one with, maybe giving me a one-liner of what your focus is there, and then tangible examples, because I think that's what helps solidify what you actually do that translates to the bedside or the EMS experience and whatnot. So let's start with digital intelligence. What does that mean, and how does that help me?
Yeah, and absolutely. And well, I appreciate you really did your research, and we are in the process of probably evolving our website. It's constantly changing, and what we work on is constantly changing. But when we think of digital intelligence, our point of view around that is, how do we build that smart enterprise? And so for healthcare, if you think about, we look at and take, there's the building blocks, there's the network, and then there's all the users and the data around the network. So think about the components, the workforce, and which is the clinicians and staff, and how do we, in terms of clinical communications, ensure a great uh, seamless experience for the workforce? What types of personas are there? Where are they on site at the hospital? Are they working from home? Are they in the field traveling? So kind of looking at that. Then we look at like, where's all the data? And we're seeing, as you well know, such a rapid acceleration of innovation in the healthcare industry with AI and robotics and advanced telemedicine. So all that data, where's all that data stored? Should it be centralized? Should it be at the edge? And then where are all the assets within the health system and connecting all of that? And what are the different use cases and technologies that are being deployed, like AR, VR, robotics, et cetera. So then we work with our healthcare partner clients to understand all that in the ecosystem and then build the proper underpinning strategic infrastructure, if you will, that will support and enable and deliver all that data to wherever it needs to go, from collecting it from the medical devices, delivering it to the clinicians to access it securely, and really delivering that data to the point of care in real time or near real time as fast as possible to improve that clinical decision support. And once you build that strategic layer, that network layer strategy, and we're advocating really around, I think we'll get into this later, but how 5G can play a role in that, and private 5G especially. And once you build out what we call an innovation platform, you can just start layering in all the different use cases and technologies that a health system wants to deploy. It really provides, and it really brings that digital intelligence to life, and basically making your enterprise smarter to know where everything is, accessing data, et cetera.
So it's really kind of layering that foundation on what everything else is kind of then built on and securely transferred through and whatnot.
And we you mentioned earlier about the value of the network, and never had we seen, like with the pandemic, the renewed focus and I guess respect for the network. It had always been an afterthought. And so when these big health systems or health plans or med tech companies are going through digital transformation and they're moving everything to the cloud, it used to be oftentimes, again, the network, they weren't thinking about the network and how do you align the network appropriately with where all the different workloads are, and especially in today's world, the AI workloads. And you really have to think about it all simultaneously together so it can work hand in glove together for that good clinician and patient experience, which is the ultimate goal, is improving those things.
Yeah, and it's crazy how when everything's working, you don't think about it even for a second. And the minute even one tool goes down or one thing's not talking to the next, everything just comes to a grinding halt. So it is very important. One, I
So,
guess, question. Yeah, sorry, go
oh,
ahead.
wait, I wanted to mention, I mean, so I think you'd asked about use cases around that. I mean, so if you think about it, it's really building that smart connected hospital ecosystem. And then even within that, there's subsets around, the smart patient room is, a lot of health systems we're talking to really have a innovation team looking at how do we enable that smart patient room. So there's a lot of things we're doing in that space to bring that together and connect it.
Yeah, absolutely. I think even the hospital I work at, I work in the ER, but for the inpatient rooms, they just launched this week a smart patient feature where they have like a little tablet where they can kind of, request meals, but then look at the results and see which consultants expected around which time and things like that, which is really cool because waiting in a hospital is not fun for anyone. One
Exactly.
question I did have following up on kind of this big umbrella is where obviously, if you're at a large hospital in Houston or Atlanta, they're going to have a lot of these networks and infrastructure set up. But when you look at rural areas, where are they at when it comes to things like these? Are they, in it for like 5 to 10 years? They're still thinking about it. Where, from your perspective, how far along are they?
It varies. In my experience, it depends on the health system, and it depends on the state and how rural the state is and where the patient populations are. So if it's a health system that has a lot of, like up in the New York's a big state, but there's a lot of rural, outside of New York City, a lot of rural areas. Here in Georgia, we have tremendous amount of rural areas. So it's a big topic of conversation. It's really kind of varies by health system and again, where their patients are. We definitely engage quite a bit in, how do we help bring that care to the rural communities, and how do we also help, there's a big focus on how do we help keep rural hospitals open.
Yeah.
So as we look at that, we were involved with ARPA-H, ARPA-H, the big moonshot funding
Yeah.
opportunities, and looking at bringing it really exciting project. I mean, it's public knowledge, so I'm not sharing, the program's public knowledge. It's, bringing advanced level hospital capabilities out to these extreme rural communities. So we have ways of doing that through some of our 5G solutions, in kind of 5G in a box, if you will. And we've put in infrastructure in an Indian reservation in Alaska as one example. We've done some creative partnerships with brick and mortar uh, facilities to locate, health stations, clinics in a box that we connect, empower, and secure. So, and then also obviously the mobile handset that a lot of people can get their healthcare through today.
Yeah, absolutely. And so moving on to security, obviously, working in a hospital, cybersecurity and threats, and you hear about these ransom attacks and whatnot sound terrifying. And I've thankfully not been of a part of a hospital system where that's happened, but like I mentioned, hurricane hits and you have no internet in the hospital for even a day or a day and a half, and it's complete chaos. I can only imagine how chaotic it is if this is something that is ongoing for a week or 2 weeks. And so when it comes to security, how do you all think about that and solutions for that? And where are we today compared to maybe even 5 or 10 years ago when it comes to protecting hospitals' infrastructure?
Yeah, it's definitely getting more and more complex with all the innovation, all the IoT growth, especially, and then even growth into the home, bringing care beyond the four walls and into the home, which is really what we think of as the connected hospital. It's inside and outside the four walls. So the attack surface we're seeing is getting bigger. So lots of conversations about, how do we secure all that together. And we have, what a lot of people don't realize is if you think about Verizon, and our network spans 150 countries. So we carry 70+% of the world's internet traffic. So we've deployed about 9 security operations centers around the globe that do nothing but watch for bad actors and threat detection and intel threats, et cetera. And we um, uh, publish a big data breach investigation report, which comes out every May. Everybody really anticipates it, and it goes through by all industries. In healthcare, obviously one of them, and where are we seeing the threats, and what were the number of breaches, what was the impact. And I think for 2024 in healthcare, there were around 1,800 breaches, with about 88% of those, being actually, data, getting to the data, capturing the data, stealing that data. We know from, the Change Healthcare and Ascension breaches last year that shut down those hospitals. So everything reverted back to paper. They couldn't access the health records. So big impact. That everything that, as we build the network platforms and connectivity solutions, we have, solutions that can weave in security on a per application basis, even based on, priorities and the applications, and in a kind of as a service way, integrate that in. So it also guarantees the security, but also provides that agility to add on and innovate, right, and bring new solutions forward. We uh, yeah, so again, attack surface is getting bigger, big portfolio of solutions that we look at. I was going to add one more point. It'll come back to me though. I forgot what, yeah, but anyway, we'll keep going.
Yeah, absolutely.
Yeah.
And then I guess we can combine these kind of last two, patient experience and remote care. I feel like they kind of go hand in hand. I looking through y'all's kind of offerings and some of the use cases, some really interesting things with remote care, and obviously you kind of mentioned some of the rural solutions and whatnot. If you could talk a little bit more about that and maybe share a tangible example of, something cool that Verizon's doing that makes that possible.
And remote care?
Yes, yeah.
Yeah, absolutely. Yeah. So looking at, like, when you go into a community, again, standing up or partnering, we partner with a company that has health station kiosks. So we actually did something little unique and creative. You have to try different things to see what's going to work. We partnered with a bank actually through a health system, University of Rochester Medical Center health system in New York, which has a lot of rural communities. And we partnered with Five Star Bank that wanted to put health stations in their banks to also address financial equity, economic development, financial services for their clients, but also give back to the community. And URMC wanted a place to send patients and enable point of care, access to care. And so we've put in a few kiosks there. And through those health stations, they can do a telehealth visit with a URMC physician, do health risk assessment profiles, et cetera. That's one example. We do a lot of remote patient monitoring solutions with our partners. We don't personally do anything clinical, but we enable it. So working with health plans to provide in underserved communities, digital inclusion programs that through our tablets or smartphones, and then stacking their solutions on top of that, any peripherals, and delivering that. Working with, again, I mentioned the Alaska, so bringing out a private 5G network to a point of need such that that community can get network access where none may have existed, to deliver healthcare. You have to, the key really is you can't just deliver the technology. You've got to partner with a health system or provider or health plan that's going to be able to engage with the patient and bring them into their family, if you will, their healthcare ecosystem for ongoing care and communication, versus some challenges sometimes with direct to consumer, which is also great and has its place. But I think we're starting to see the key is really partnering with these health systems and rural hospitals. It's like a win-win for everybody. You're propping up the rural health systems to give them capabilities where the patient can remain at that hospital. There's a revenue driver for them, and then it's also helping that health system extend their brand into the community and deliver better patient access for their care. So I don't know if did that fully answer your question around?
It
Yeah,
does, yeah,
yeah.
yeah.
And I think there was one more part to it you asked about.
Yeah, or I was saying the patient experience part of
Oh,
it
the
kind of
patient
goes hand in
experience.
hand, and it really does, because obviously if you're in a rural community and you have no hospital for 50 miles, that's not a good experience. But if you could go 5 miles down the road and get the care that you need, that's ideal.
Yeah, exactly. So and also, so from patient experience, we look at and we build, how do we build that digital front door? And, if it's for a health system, it's, how do you enable that the first welcome mat, if you will, or entry point for a patient to, is either calling or through the web or an app, right? That's got to be a smooth, seamless, secure experience. They've got to be able to schedule, get referrals. There's got to be good follow up for the health system to follow up. And a lot of patients, if they don't have that good experience with the health system in being able to get an appointment, and then after they've had the appointment and they're back home with the right follow up care, the health system is going to lose that patient. So we, through our digital front door solutions, can help build that, from that first point of entry and triaging what kind of care does that patient need. Maybe they just need a virtual care visit initially. Maybe they need to go to urgent care. Maybe they need to go to a health station clinic that we can route them to, or maybe they need to go to the hospital or speak to a specialist. So providing that care navigation through the digital front door is key to patient experience. A lot of focus on that, that we're seeing.
Yeah, absolutely. If you go to the ER and I refer you to someone and then you get a text and saying, hey, the appointment's at 2 p.m. on Tuesday and this is where you need to go, that's convenient. But if you're the one who has to make the call and wait on the line for 20 minutes and then, do all that, that's much more burdensome. And like you said, the more secure and streamlined that process is, because of technology, the patient's going to be loyal to that hospital, but it's going to be a better experience for them and better outcomes. We've touched on 5G a few times. As a
Right.
layperson, I think of 5G as like, hey, I've got 5G internet on my phone, things are good, I can navigate and get to where I need to, or whatever the case may be. Tell me a bit more about 5G, just in terms of, basic question, what is 5G? Like, what kind of network is it? How is it different than other solutions? And then why is it so reliable when it comes to healthcare, and why do health systems trust it, want to use it, and implement solutions on that network?
Yeah, so to your point, there's public 5G, which consumers are enjoying, around the country today. Coverage is continuing to get better and better and better. We've invested a lot in that. And then there's what we call private 5G, so which we're having a lot of conversations with health systems around deploying private 5G. It's really if you think about uh, within the health system and the big a lot of the with the acceleration of all this innovation again with AI and the massive amounts of data and imaging that needs to be moved within that hospital, um, building that smart patient room where patients, are monitored in real time in an automated fashion through cameras and computer vision technology, into that digital intelligence, if you will, those applications. Patients even being able to, through voice activated devices like smart Alexa, as an example, call out for food or a nurse or their medication. All those use cases and intelligent automation applications require really low. Well, number one, it's generating lots of data, and it requires really low latency. So 5G, when you compare it to legacy infrastructures that are currently in health systems around Wi-Fi, really provides a lot more bandwidth in terms of speed, a lot more capacity, to handle all the different things, all the data coming out of the med tech devices, IoT devices, clinical communications, et cetera. And then low latency. There's certain use cases and applications if you're wanting to do robotic surgery that need, or even the remote patient monitoring that need lower latency. So 5G, that technology delivers all that at scale. We hear a lot of pain within the health systems around, hey, my Wi-Fi, it's getting more and more complex to manage. It's getting congested. There's security vulnerabilities. The handoffs aren't as smooth as you get with 5G. So if you think about taking the macro Verizon wireless network that again that consumers know and enjoy, and literally building like a mini private wireless network within the four walls of the hospital that blankets that hospital floor, through the infrastructure, and it gives better seamless handoffs, inherently more secure. It's not touching the internet. You have to have special authenticated SIMs to even get on the network. The health system can control on their own what gets on the network. We manage it for them, but they own the network. It's their own literal private wireless network. Just works much better. And so we're seeing that as the next generation evolution of really enabling all the things that these health system want to deploy and deliver. Uh,
Yeah, that makes
so
sense. And
it's really a reimagining. Yeah, yeah.
would you say it's more in the innovative category, in terms of like hospitals are now starting to jump on board, or a good portion of them have been using it for a while? Where does it fit in that
Yeah, it's
spectrum?
early. There's only honestly a handful of health systems today that have deployed it. Um, we're seeing when there's new construction, new hospitals being built, that it's a no-brainer and out of the gate putting in private 5G. You still have Wi-Fi, right? We're not saying get rid of Wi-Fi, but you
Yeah.
free it up and you use it for staff communications or lower critical applications, right? Then we're seeing, there's a perfect storm really brewing. We think 2025 is going to be a big growth year for it, just again with all the innovation around AI and all the things that they want to do that relieves again the burden on the hospital is becoming a member of the care team. Really, it's an automated, intelligent member of the care team with eyes and ears. In order to enable that, you really need these next generation networks. Wi-Fi is just not going to be sustainable for it in the long run. We're seeing pockets of innovation, but to really scale it, you've got to evolve. And we're seeing trigger points around, let's say, like in building coverage solutions that are built within hospital systems. As those become end of life, that's a great trigger point to start looking at evolving into these, next generation connectivity platforms. So it's still slow adoption because everything in healthcare is like hard, complex. It's hard to change. You're dealing with life and death. It's disruptive, right? So timing is definitely critical. You can start small with some things, again, like the smart patient room, and kind of take that bucket and deploy that. And there's lots of wins around that, just both for the clinicians and the patients. So we're seeing some good focus in that area.
Yeah, that's from my point of view, the kind of exciting thing over the last few years where healthcare is very traditionally like slow and slow to adapt change. But it seems like the last few years, especially with some of these AI tools and whatnot, they have kind of been moving at a faster pace than traditionally. And so for me, it's exciting to actually see some of these things being implemented at even like the hospital I may be working at.
Right.
Um, when you we've mentioned AI a few times as well. I can't have
Yeah,
a podcast about
I know,
technology
right?
without mentioning AI. Could be probably a 4 hour conversation on its own. But I guess we'll start at the point of it seems like when you've brought up AI, it's that it uses a lot of energy, data, very complex kind of amount of I guess data, if you will, compared to other technologies. And so for that to be efficient and operational, it seems like the network and the foundation has to be better than what we've had before. Would that be an accurate statement?
Oh, absolutely. Yeah. And we actually just launched something called AI Connect, which you may have seen if you're looking at our website, which is really more wide area network, like extending out from the hospital to all the data centers around, whether it's, AWS, Microsoft, IBM, Oracle, et cetera, all the big cloud providers, right? And leveraging our metro fiber networks, which are pretty deep and vast, that we've built and invested in, along with even dark fiber solutions to turn up new fiber, to move that data, to connect it to these the data centers. You're seeing like a ton of investment, right, in the compute and storage for data centers recently. Then of course China came out with DeepSeek, so that's kind
Yeah.
of adding an interesting wrinkle. Yeah. But again, the network is a key part that needs to marry up to where all the data and compute is happening. So
Now,
we
do
deliver
you
that. Yeah.
Yeah. Do you all offer any kind of AI solutions, or you focus mostly on the network part of things?
Yeah, it's a good question. We're really more the enabler of the AI solutions, and in healthcare, we partner with different AI solution companies. We do leverage AI on our own network to identify even security vulnerabilities, gaps in coverage, network performance, and that inherently benefits our customers. So we use a lot of that internally. We're using it a lot for our own customer experience as well. We run one of the largest contact centers in the world. So we do deploy, and then we get learnings from that as well, and how do we apply that to help our customers. But we partner, so I'm working with a few different partners around like augmented reality AI platform solutions, smart patient room solutions around, again, fall detection, remote patient monitoring, clinical documentation, care coordination, because they want to get that connectivity like built into their solution so it'll work better, perform better. So we layer those on top of our network. We are not right now reselling those solutions ourselves or building those solutions ourselves. Again, I like to say we're not in healthcare, we enable healthcare. We
Yeah.
know our lane, and Verizon actually has evolved over the years in who do we want to be in healthcare, and we've landed squarely. I mean, our lane is really that network enabler, that connective tissue, if you will, for the ecosystem.
And that's great to
Yeah,
hear.
yeah, yeah. I mean, we
C-
partner
c-
also with all the big med tech companies, right?
yeah.
And the new startup, IoT med tech companies that want to get enabled.
Yeah, absolutely. And I love that because I feel like a lot of large organizations try to become the healthcare delivery mechanism because they think it may be lucrative or it's shiny and whatnot. And we've seen a lot of large organizations fail at that. And I think that approach is really unique because obviously people who've worked in healthcare their entire lives probably do the healthcare part good, but they need that extra boost of enabling them and taking them to the next level. And I think that's really good to hear. When it comes to, and this may not be from your position at Verizon, but just maybe a personal position, there's lots of, AI startups and AI offerings and tools and new companies. And a lot of it is, it's almost like the whole blockchain thing a few years ago, where a lot of it was hype. And then there's like maybe 10 or 20% that's really providing value and solutions. How do you personally distinguish between hype and, hey, this is actually providing a value in a solution and it's actually AI and they didn't just stamp a label on top of
Yeah.
it?
No, it's a great point and question. And our team, we have a small team. We're this entrepreneurial team within Verizon, right? And so we do get approached and spend a lot of time looking at different startups and that want to partner with us, right? And we definitely have to be very judicious. So a few things we look for: one, do who's backing and funding them, I guess, right? If there's some credible health systems behind it that, and some trials that they've done and pilots or existing customer that adds to the credibility. If they need FDA approval and got FDA approval, that's huge, because that means we can go to market, start scaling it. Um, you know, again, just kind of like, who do they have behind them, I think is a big thing. And do they have customers? Most health systems, I mean, even with us, when we talk about solutions, even we do a lot of new things, right, that we may be launching, and they want to know if we deployed it anywhere yet.
Yeah.
I mean, you come from a health system, right? You want to know, has this been deployed? And sometimes it hasn't. A lot of this is so new that a lot of the stuff, has not been deployed yet, but you got to start somewhere. So,
Yeah.
do pilots. But it is, I mean, I just came from CES, and it was just overwhelming. I don't know how health system leaders even, yeah, decide. So I think they're even starting to say, like, we just have to pick a few big partners and integrators that have vetted these solutions and can help us scale. So we're a big company, and so we also need to align ourselves with big companies that we know can kind of keep up and scale, because once we open our floodgates on something, and it could crush a small company pretty quickly. So you have to really kind of think through, how do you roll something out? Again, to your point, like, who really is going to make it or not? Who's got the credibility? Yeah, I don't have a magic bullet on that, to be
Yeah.
honest. But I mean, everything always sounds, we get excited about everything, and then we have to kind of come back to reality of, like, okay, what's realistic that can really be deployed. And even with AI, there's a lot of hype with the clinical use cases versus operational use cases. I mean, I think we're seeing more trust around operational use cases, but even those need to be tested and validated and clinically validated. And but I think we're seeing, and you probably know this, right, more use cases around clinical documentation and care coordination versus some of the really cutting edge AI intelligence on the clinical piece.
Yeah, absolutely. One of
Yeah.
my favorite actual tools that I've used is like ambient listening and scribe
Yes.
technology, and it's really good and it saves me a whole bunch of time, and I can spend more time with a patient and look at them and all that stuff. And so it's been
Yes.
awesome. But yeah, I wouldn't want to be the digital innovation person at a large health system because every solution is like, oh, we're going to save lives and save money, and then you have to like dig through like 20 solutions. It's like which one's actually real and which one's not. And of course, if something actually does work, you don't want to say no to it because it could potentially be beneficial. You mentioned you were at CES. Did anything in the AI world stick out where you came back and you're like, oh wow, that was really cool. I wonder where they'll be in a few years, or any general theme or anything like that that stuck with you?
I, I tell you, I could have spent a month there not seeing everything. It was quite
Yeah.
overwhelming. It was my first one. I think got
Okay.
lessons learned for me on maybe how to next time, you know, navigate it. But no, I don't know that there were any huge surprises. It's just, I think the quantity of things was a surprise, or maybe it shouldn't have been a surprise, but just the quantity. I mean, lots of robotics, and the digital health track was huge. So lots of interesting robotics, lots of, which is very promising, contactless solutions, especially into the home to do like really full patient monitoring, where you don't have to wear wearables, which I think is really compelling. One of the, I think, reasons for slower adoption in remote patient monitoring is the just the technology, the patient side technology needs to be frictionless. So saw a lot around that, a lot of AI companions, to voice companions, right, with that get trained and get to know the person. So a lot of aging in place solutions. Um, you know, a lot of, I mean, and then the non-healthcare, of course, really with the autonomous vehicles and entertainment, really, and gadgets was quite incredible.
Yeah, absolutely.
Yeah.
It's definitely a bucket list event to go to for myself. I haven't been to one, so hopefully next year. Kind of shifting gears a little, when a hospital system or organization comes to you for help with a solution or implementation of something, I feel like a lot of times projects may fail because they don't have the right buy-in from like people within the organization. Um, who all needs to be at the table? Do clinicians need to be a part of that conversation? Obviously, the technology IT folks need to be there. Who else? CFOs, just a general conversation around what you've seen when projects don't go well versus when they do go well.
Yeah, well, first and foremost, and we're seeing this more and more and advocating for this more and more, the nurses need to be at the table. The nurses are the key. They know the care workflow. They're probably the most burdened, within the workforce. Um, and so we spend actually a lot of time talking to nurses, and kind of understanding what are their pain points and challenges in workflow. And we do, when we do a workshop, is sometimes it starts with like, let's do a workshop and get the right stakeholders in the room. It's IT, obviously, of course, right? IT security is a huge part. Oftentimes, they're the last to know, and then it puts the whole project on hold and fails because you haven't gotten their buy-in up front. Clinicians, yes, the innovation officers, the chief experience officers that are focused on that patient experience. So all those, the facilities managers, because there's solutions we do around accelerated access, facial recognition, et cetera, is like we're seeing a lot of traction, um, so, and then physical security, even things that like looking at patient flow, patient safety, even looking at parking lots and what's happening out there to really have eyes and ears on the whole health system and patients coming in and out, clinicians coming in and out. Even in the ED, right, there's solutions around, there's more workplace violence happening in the ED, overcrowded, et cetera. So different stakeholders from different service lines on the clinician side, the nurses, IT, security, all those. And then we often get, clinicians sometimes, and not as much anymore, but it'd be like, why do I need to talk to Verizon? Like they don't, right? And ultimately it is the IT kind of that ends up on a collaborative basis, designing the end network, but we like to talk to all those different stakeholders and get them to the tables for really discovery purposes. And where are you trying to innovate? What use cases are you trying to deploy? Because we need to understand this so that we can build the proper infrastructure that, underneath it that supports it.
Yeah, absolutely. And I think that's so important because, yeah, first of all, I agree. Nurses are the heartbeat of the hospital and they, make everything happen. And so it's exciting for you, for me to hear you say that. But yeah, it's not just, hey, maybe the CEO is super excited about something or someone from IT super excited about someone, then some solution and everyone else is like, this makes no sense. And then that project's probably not going to do great. So yeah,
Right.
it definitely is a all hands on deck approach, and everyone needs to have some level of investment and commitment for something to succeed. Um,
Absolutely.
you kind of alluded to 2025 being an exciting year, and we're kind of talking here at the end of January. Just kind of looking forward, what makes you think that it is going to be exciting? Obviously, you turn on the news and everything's about technology, and as you mentioned, DeepSeek just a week ago. Like it seems like there's something new every day. But kind of from your perspective, why are you excited about 2025?
We're just seeing like a lot of great traction and conversations around actually starting to really deploy some of these, these new platforms to support a lot of the innovation that these health systems want to deploy. I think even the acceleration of things like value-based care and how do you align with that? You need the right technology and tools to be able to support those things, really take cost out of the industry, and drive revenue for providers. Um, yeah, it's just a perfect storm, and just the innovation, the attention, even all the attention on AI, whether hype or not, it's pretty compelling, the things that we'll be able to do with it. Um, that we do, we are seeing more, again, the more traction to where actually people are focused on accelerating the execution versus just talking about it. It's been a few years in the making. Uh, it's uh, yeah, so it's really kind of all coming together. There's so many pain points, I think, also in parallel, that and challenges that are complex, that need to be solved. So technology has a role and a place in that. And and so for our what we do and our core competency around connectivity, when we go to these conferences now, it's actually top of mind for everybody. Connectivity is one of the big topics that people want to hear about, learn, understand, and transform. So we're optimistic about the growth trajectory, and really helping have an impact on care. There's some unknowns, obviously, as a new administration comes in, and how's that going to impact funding on different initiatives, so there's that uncertainty.
Yeah,
But the
absolutely. But no, I
technology, yeah, yeah. I mean, healthcare, there's so much innovation on the clinical side, and we're getting ready to get a Vive. We'll be at HIMSS and later this year at Health, and it's a little different than CES, which is a bit more consumer focused, but there'll be some really innovative, technology and med tech companies, showing their solutions, and all that needs that supporting infrastructure to connect it together.
Yeah, absolutely. I'm equally excited, and how I found out, like you can't get doctors to join committees at a hospital, no matter what you bribe them with. But they had a call for like the AI health committee last fall, and thankfully I got on it. But there was like a waiting list of doctors wanting to be on this committee, and that showed me that, oh wow, there is like a huge interest and excitement amongst clinicians that are wanting to volunteer their time and learn about these things and find tools that'll help their patients and their teams. But thanks so much for chatting with me. Is there anything we maybe haven't covered or anything else you wanted to say before we wrap this up?
Yeah, I think we covered a lot of ground. I mean, I'm continually impressed though by the number of clinicians that come to the conferences and are really like involved and want to learn more about what we do. It kind of pleasantly continues to surprise me. So hats off to all the clinicians also trying to, like you, to trying to understand it and then help bring it, to life for adoption.
Yeah,
So it's
absolutely.
yeah,
I
yeah.
always try to peer pressure my colleagues into getting educating themselves or getting involved in some way, because obviously, like we kind of just talked about, if there's no buy-in from everyone on the team, at least to some extent, then these solutions don't really matter or they won't work. So thanks so much for taking the time to share your vast amount of knowledge. And we probably could talk for another 3 hours, but I
Yeah,
look forward to
thanks.
continuing the conversation and hope to see you at one of these conferences soon.
Yeah, sounds great. Thanks for having me.
Absolutely.